What is peritoneal dialysis? Inside your child's belly, also called the abdomen, there are organs just like the kidneys: the liver, the spleen, the intestines, and others. Here's your abdomen. Inside of the abdomen is covered in a thin lining or membrane, which is called the peritoneum. This is where peritoneal dialysis gets its name. The peritoneum is full of blood vessels. It acts as a filter to help clean blood during peritoneal dialysis. Before dialysis can start, a special tube called a peritoneal dialysis catheter will need to be placed inside your child's abdomen. Part of the catheter stays outside of the body, connecting to the peritoneal cavity. This allows us to pump and drain an important liquid called dialysate into your child's abdomen. Let's travel into your child's peritoneal cavity and see how this works. There are 3 steps of peritoneal dialysis: drain, fill, and dwell. Together, these steps represent one cycle. First, fluid is drained from the abdomen and leaves the body through the dialysis catheter. It takes toxins out of the body with it. Step 2 is fill. A special sugary solution called dialysate enters the peritoneal cavity through the catheter. Step 3 is dwell. The dialysate solution sits in the abdomen and pulls waste and extra fluid from the body. The dwell time is how long the fluid sits in the abdomen. The steps repeat, starting another cycle of drain, fill, and dwell. Each cycle should remove some fluid from the body. The extra fluid that is removed is called ultrafiltrate, or UF. Let's review some concepts now. When the kidneys stop working, we need dialysis. Dialysis removes toxins and extra fluid from the body.
How does PD work? To start, one needs a PD catheter, which is surgically placed, usually in the abdominal area. Ideally, the catheter placement should be where one can easily reach and see the catheter. Once the catheter is ready for use, you are prepared for PD. You might be wondering, how does the peritoneum work? During dwell time, your peritoneum acts like a natural filter through diffusion, which allows the toxins to move from the blood into the peritoneal fluid. Fluid removal, also called ultrafiltration, is done through osmosis. The dialysate has sugar or dextrose, which will serve as the osmotic agent. Water molecules will then move from the blood to the dialysate. PD solutions are available in 3 dextrose strengths. The higher the solution, the more fluid it can remove. There's a PD solution called icodextrin that is non-dextrose based, and it can do ultrafiltration with an extended dwell time. PD solution also comes in different volumes. Larger volumes enhance filtration, but should be chosen based on size and comfort. Some patients may experience discomfort with a larger volume of solution. How do we know if the PD treatment is working? The answer is KT/V, which measures how much waste your treatment is clearing. According to Medicare guidelines, a KT/V of 1.7 or higher every 4 months means your dialysis is adequate. What happens if a patient's KT/V is below 1.7? The doctor will adjust the prescription either by increasing the number of exchanges or dialysate volume. It could be dwell time or sometimes switching to icodextrin. Every person's peritoneum is unique, which is why some PD patients have different outcomes. There's a test called PET, or peritoneal equilibrium test, that helps determine the membrane's permeability. There are 4 types: high, high average, low average, and low. Knowing your membrane type helps doctors personalize your treatment for the best results. PD complications. One of the major complications associated with PD is peritonitis. Peritonitis is the inflammation of the peritoneum, often caused by bacteria or fungi. Symptoms may include abdominal pain, tenderness within the abdomen, nausea and vomiting, diarrhea, fever, and draining cloudy peritoneal fluid. Peritonitis is life-threatening and requires immediate treatment to avoid sepsis. PD patients are trained to recognize the signs and symptoms and know how to respond, often with intraperitoneal antibiotics until further medical care is received. Is PD right for you? PD is not suitable for everyone, especially if you have a history of multiple abdominal surgeries, obesity, no residual kidney function, and a low transport membrane. Researching and discussing with your doctor is crucial to determine if PD fits your health needs and lifestyle. Thanks for watching and take care of your kidneys.